Hello, everybody. I'm sorry, we are having technical difficulties. Our main speaker's struggling to sign in at the moment. So I think what we'll do is we'll make a start, and Philippa will join us as soon as she's able. Sorry about this. Unfortunately, she's struggling to get signed into her account. So my name is Tim Devaney. I've been working with this programme since the very beginning. Working as part of the team that Philippa has been leading, and it's been a team effort, I must say. And when I say team, a team of experts by experience: Paula McGowan, Tom McGowan, Department of Health and Social Care. The list goes on and on for over 5 years. So today's programme, as with all our work, has been co-produced with our experts by experience and with our colleagues. Before we start, just need to go through some housekeeping, just to make sure the webinar runs as smoothly as possible for all of us. So we're recording today's session, and the slides will be sent out in about a couple of weeks when we've managed to pull it all together. We're going to use some pre-recorded videos and some audios, so please make sure your volume's turned up and your MS Teams closed captions are turned on if you would like those, if you'd like to see those captions. Thank you for all the questions that you've submitted and signed up for the webinar. If you want to ask a question during the webinar, you can do so using the question function, and we aim to publish the answers where we can in that space for you there. We'll answer as many as possible during the presentation, but we may need to come back at the end for some of the frequently asked questions. We've got a section there at the end, and we have a planned break, the final in the middle, because the session will last about 2 hours in total. So just to run through the agenda quickly, we're really pleased that our key partners and our colleagues can join us today to deliver the webinar. And as you can see, we have updates from the Department of Health and Social Care, the Care Quality Commission, and Paula McGowan. They will be presenting updates from some of our approved trainers and sharing resources to help employers roll out Oliver's training. Since Paula's petition in 2016, Oliver's training has had strong public, government and cross-party parliamentary support, and we've worked with a number of ministers throughout that period who have helped us get to where we are today. I'm now going to introduce the first agenda item, which is a pre-recorded message from Maria Caulfield, Minister for Women and for Mental Health.
Good morning all, and thank you for attending today's event on the Oliver McGowan Mandatory Training. I'm the Minister for Mental Health and Women's Health and have responsibility for learning disability and autism. It's wonderful to bring together today so many experts by experience, service providers and professionals in the health and social care sectors to renew our collective commitment to this important programme. In my role, I've had the privilege of meeting with people with a learning disability and autistic people, their families and carers, and with many dedicated health and social care staff. The stories they have shared are a valuable reminder of the need for high quality health and care for each and every individual. As a nurse by background, I know firsthand of the importance of making this a reality. I know that we're all committed to tackling the barriers that people with a learning disability and autistic people face in accessing the right care and support. Recent data showed that on average, males with a learning disability die 21 years younger than males from the general population. Females die 25 years younger than females from the general population. This data serves as a vital reminder that we must continue to drive improvements to health and care services. Ensuring that our health and care workforce are empowered with the right knowledge and skills is a crucial step towards making these improvements. This is why we introduced a statutory requirement from July 2022 for all providers registered with the Care Quality Commission to ensure their staff receive specific training on learning disability and autism training appropriate to their role. This represents a significant moment in the journey towards improving the care and treatment of people with a learning disability and autistic people. I'm delighted about the significant progress we have made to ensure staff have the right knowledge and skills, which I will now set out. The Oliver McGowan Mandatory Training is the government's recommended training package to meet this requirement. The training is named after Oliver McGowan, who you will all know was a young autistic teenager with a mild learning disability. Oliver sadly died after having a severe reaction to medication, which he and his family had asked for him not to receive. Oliver's parents, Paula and Tom McGowan, have been inspirational in their campaign for better training for health and care staff, and I thank them for their continued support of this work. What truly sets Oliver's training apart is that co-production is at the heart of the training and has been from the very start. The training was trialled with over 8,000 people in 2021. People with a learning disability and autistic people have been involved at all stages and continue to be involved in delivery. Delivering the training with trainers with lived experience not only ensures that the content is relevant and impactful, but it also provides much needed job opportunities for people with a learning disability and autistic people. Since Oliver's training has started to be rolled out across health and social care, the training has helped staff and services create the right culture to adapt care and support to each person's needs. The first part of the training, an e-learning package, was launched in November 2022, and as of now, over 1.4 million people have completed this element. I've completed the e-learning myself and thought it was excellent. Most importantly, we continue to hear from people with a learning disability, autistic people and their families every day about the genuine and real difference that this training has made to their lives. Feedback from staff who've completed the training has likewise been overwhelmingly positive. We all have a part to play to keep up this momentum and achieve the positive cultural change we are striving towards for our health and care services. I urge you all to complete the training yourselves and champion Oliver's training in your organisations and networks. Local leaders should ensure that Oliver's training is a part of their core training offer for their staff. We have made excellent progress to ensure this is the case. Firstly, we've launched a consultation on the Oliver McGowan Code of Practice in June 2023, which will support providers to meet the legal requirement. The code sets out 4 standards to guide providers on what training should include and how it should be delivered. It also sets out that Oliver's training is the government's recommended package. The consultation fully closed in October 2023, and I'm really pleased that the majority of respondents found the code clear and were supportive of its purpose. Secondly, we have taken steps to ensure this training is seen as an essential part of learning and development for people working in health and social care. In January of this year, we announced plans to support the adult social care workforce. This included the launch of the Care Workforce Pathway as the first national career structure for care workers and launch of the Care Certificate as a standardised training package. I'm pleased that both the pathway and certificate include clear messages on learning disability and autism awareness and reinforce the importance of completing Oliver's training. On the health side, we published the 2024-25 NHS Standard Contract in February, which commissioners must follow for all healthcare services. The contract clearly states that we recommend staff complete Oliver's training. I'd like to end by thanking every person who's been involved in campaigning for mandatory training on learning disability and autism, all of those involved in Oliver's training to date and those who supported the development of the Code of Practice. With World Autism Acceptance Weeks coming up, there's no better time for us to renew our commitment to make further progress on delivering Oliver's training. Training to all staff. We must all work together to ensure that every person with a learning disability and autistic person receives safe, compassionate and high quality care. Good morning.
Good morning, everyone. I'm just going to check that everyone can hear me because I do apologise for the technical issues I had. So I've got some thumbs up. So I am so sorry with the technical issues, but morning, everyone. And I'm delighted to see so many people on the call today. It's brilliant. So for people who don't know me, I'm Philippa Spicer, and I've been leading the work with the team that I know Tim introduced earlier for about 5 years now. So I'm delighted to be able to be here today and give you an update on where we've got to. So to start the session, I'm going to provide a little bit of an overview of where the programme for the co-development and co-delivery of the Oliver McGowan Mandatory Training in Learning Disability and Autism is now 5 years along its journey. As we know, in England, there are approximately 1.3 million people with a learning disability in England, including over 950,000 adults aged 18 or over. There are approximately 1 million autistic people in the UK, and of those, between 20 and 30% also have a learning disability. So this is a significant number of people we need to make sure have the right care and support when accessing health and care services. Now, I know today our focus is about Oliver's training, but I want to stress that this training is a vital step towards a health and care system which has the right culture, knowledge and skills to support people with a learning disability and autistic people. Oliver's training is just one of the commitments to improving health outcomes for autistic people and people with a learning disability. We have launched a number of additional education and training programs, and such information you can find out on our website. And also, if you have a look at NHS England's website, you'll find a number of initiatives and significant funding that is being put in to improve services as well as education and training. I thought it would be helpful, and I know many of you know this already, but I thought it would be helpful just to remind people what the training looks like. So this slide, which I'm assuming everybody does know, is a kind of pictorial version of Oliver's training. So as you know, it comes in 2 tiers, Tier 1 and Tier 2. Both tiers start with the 90 minutes e-learning, and that is supported with a handbook. Now, I would like to stress that the e-learning, it's not your kind of typical e-learning, okay? So I'm sure that many of you have done the e-learning on the call today. But it really is a collection of videos. It's a collection of, it's hearing the voices of our experts with lived experience. And that makes it different from other e-learning. It makes it far more powerful. So if you haven't done it, I would urge you to do it. But that is the basis of all of the training, both Tier 1 and Tier 2. So to complete Tier 1, you will do an online facilitated session that's about an hour. And that is a facilitated session with somebody with a learning disability and somebody that's autistic. Now, there's nothing to stop the facilitator being somebody with lived experience, but they can't replace the role of the expert with lived experience. Okay, so it'll always be a trio developing that delivering that training. Tier 2 is a face-to-face day. Now, this day is split into 2 halves. Okay, so one half is learning disabilities and the other half is for autism. Each of those is led by a facilitator together with, so co-trained with the expert with lived experience. So again, there's nothing that says that that facilitator for the learning disability session can't be somebody with a learning disability, but they can't replace the expert with lived experience. So you could have 2 people, if that makes sense, but they can't replace that person. Now, the reason that the day is designed in 2 half days is that in the pilots, we were asked to do it this way, essentially, in the evaluation, so that organisations can either run it as a day, or they can run it actually separately in 2 half days, whatever works for the organisation and for the staff. So training will be required to be completed every 3 years. It is statutory training. It might have to be done within 3 years if somebody changes their role. So supposing somebody's done Tier 1 training and then their role changes and they're required to do Tier 2, then they would of course need to do that training. But if everything stays the same, then you would just need to do the training every 3 years. Of course, we acknowledge that at the moment there's a delay between doing the e-learning part of the training and the face-to-face element, whether that's online or actually face-to-face. This is clearly because it is it's taking a significant amount of time to build the infrastructure, to recruit and train trainers, to deliver the training. So at the moment we know that, and we kind of have to accept that because we're kind of, you know, we're on this journey together. But once we're business as usual, then the kind of expectation is that you would do the online session or the face-to-face session as soon as practical after you've done the e-learning. So the e-learning is fresh in your mind, and then you go on to do the part 2 of the training. So I say it could be a couple of weeks, probably shouldn't be more than 6 weeks after you've done the e-learning, because then you probably need to do the e-learning again. So once we're up and running and everything's kind of business as usual, that's what we would recommend. And of course, you don't complete the training until you've done both parts. Okay, so it won't be recorded that you've completed it until both Tier 1 and Tier 2, Part 1 and 2 is complete. We get asked a lot of time when we do these kind of like presentations and sessions about who needs to do which tier. There is some guidance that will be in the code of practice, but you know, the Act is very clear. The Act is that the responsibility is the employer's. The responsibility is the organisation to determine through something like a training needs assessment to say, okay, who needs to do which training in my organisation? And they need to do that, and they need to be accountable for that and make sure their staff are trained appropriately. Now, what we would say is, don't look at kind of typical kind of training. You might think, oh, well, this is just for clinical staff or just for support staff. In the sessions that we've done, we think that estate staff, HR staff, you know, this is about reasonable adjustments. Every process that really we enact in the NHS and in care probably could benefit from, you know, looking at it through the lens of somebody with a learning disability or autistic people. We employ a lot of people, autistic people and people with learning disabilities. So actually, this is good training for everybody to do. But determining Tier 1 or Tier 2, that's for the organisation to decide. Okay, so Oliver's training obviously delivers the learning outcomes on both learning disability and autism, and provides that foundation for health and care staff right across, and the packages are relevant. So it will be kind of like tweaked, whether that's the people delivering the training, so the experts with lived experience bringing their stories that are relevant to the kind of session they're running. And we leave that again to systems and providers to work through what's most appropriate for the audience. Depending on the role, staff may require further capabilities. Okay, so sometimes you will hear people talk about Tier 3, okay, something beyond Tier 2 training. It could be Tier 3, it could be specialist training, something like that. That is for, again, the employer to determine. So the employer needs to do its training needs analysis and say, okay, which of my staff need Tier 1, which need Tier 2, and who needs to do more training, depending probably on where they're working, what services they're involved in, and that type of thing. And it's for them to make sure that they put in the appropriate training provision for those staff. The name of Oliver's training is the Oliver McGowan Mandatory Training in Learning Disability and Autism. But I do want to take this opportunity, and again, those people who've heard me present before will know that I do remind people that this is statutory training. Okay, this is set out in the Health and Care Act of 2022, and it needs to be seen alongside health and safety training, safeguarding, you know, resuscitation, those types of training. So therefore, we do get, probably less so now, but in the kind of earlier days, we get a lot of people saying, oh, but this is more training to do. We can't, you know, take people away from delivering services, etc. But the more we've worked together on the rollout and people's understanding of what we're trying to do, it's clear that actually there might be something that needs to stop, but it's not this training. This training is statutory, has to jump the queue, if you like, and go right up to the top with other statutory training. And it's for organisations to look at their priorities and think, there might be something else that I actually need to maybe not do this year. And I know that's, you know, you might say, well, that's easy to say, but that is the fact. This is statutory training. And I think the thing that we must, you know, we must all remember that we're doing together is this isn't a nice to do. Okay, this is about changing the culture, improving outcomes and experience of people with a learning disability and autistic people. It is a priority for all of us. Okay, so it's really, really important to see it in that context. It is so important that we're really pleased that NHS England have actually added the requirement to the NHS standard contract for 2024-25. So it actually says in the contracts that providers need to ensure that all staff receive the training on learning disability and autism appropriate to their role, as the code does and as the Act does. But it references Oliver's training, it references the code of practice, and it recommends Oliver's training because it actually states that it is the Department of Health and Social Care's and the government's and NHS England's preferred recommended training. Okay, so that's what the contract states. We are, of course, aware that the content and the kind of the programme will need to be kept up to date, to be reviewed, regular intervals. You know, the law might change in some other regard that the training will need to take account of. And we're going to be doing a longitudinal study on the outcomes of the training. So again, as we start to kind of like learn and think that might work, that, you know, getting feedback all the time from those that are currently delivering the training, and we're looking at that kind of continuous improvement model. You know, we're more than happy to keep that co-production, co-delivery conversation, because it's really important that that underpins it. But I think it is important to say that that will be controlled. Okay, the content will be controlled by the national team. So we might together improve something, we might together, you know, change something in the content, but it will be consistent. Okay, it will not be for individual employers to tweak it and change it. It is really, really important that it is a consistent package delivered consistently. So how are we actually rolling out the training? We worked on this quite a lot. We had lots of conversations. Again, co-production. We worked with colleagues with lived experience. We worked with our regions. We took some soundings from clinicians. You know, we had some workshops. It was what's the best way to roll this out? And we wanted to take really the opportunity of the new NHS operating framework. You know, the way that it's working with the 7 regions and then the 42 systems, and then the providers. We wanted to make sure that we used that and said to those systems that basically they know their population, they know the services they provide, they know their own outcomes and benefits of, you know, in terms of what they're trying to do, their demographics. They can recruit people with lived experience who are reflective of their population. So whichever way we went around the circle, we thought this has to be the way to do it. So that's what we've done. We have worked through the regions, through the systems, who are then looking at what's the best way to build that infrastructure and make sure that it is a sustainable model. And that's really hard to do. Okay, we're not, you know, underestimating that. That's a really hard thing to do. But if you think about the ICSs, you know, we've got some small ones, we've got some massive ones, and actually how they will and are actually rolling this out is different, and it will suit their needs. So that's the model that we took to try and make it as sustainable as possible as it moves forward. In terms of the rollout, we do know though that it's potentially going to take 3 years to roll it out. Building that infrastructure is really hard. This is, you know, I've been in the health service for too many years to probably own up to on this call, but this is the biggest training rollout that I've been involved in, and I've been involved in training a long time. You know, I just keep saying this is about, you know, that culture change, and to be recruiting enough people with lived experience to make this sustainable, to deliver this training in a co-delivered way is really hard. Okay, so it is going to take time, but it's worth doing it properly. All right, if we do this properly, we're going to have, you know, much better outcomes for people, much better experiences for people. So we need to do that, and we need to just accept that that's the, you know, that's kind of the journey we're on. And of course, the integrated care boards as well work very closely with their community services, you know, with sort of, you know, primary care, dentistry. We've had some really good conversations with those types of people. More to do around some of those community services, but again, those integrated care boards and systems have those relationships and should be able to support that. In terms of priorities, again, another thing that we get asked, and it's worth just mentioning, is, you know, if I'm a big employer, or I'm a big provider, or I'm, you know, I employ thousands of people, how do I decide who does it first? If it's going to take me 3 years to roll it out, or 2 years, or whatever, how do I decide who to do it? And again, what we'd suggest is, you know, it's really the employer and the organisation's responsibility to prioritise. But what we were told through the development of the training and the piloting and the evaluation from colleagues with lived experience was that unplanned situations, unplanned care, you know, primary care, ambulance services, A&E departments were probably the ones that scared them the most, in terms of you're not too sure what you know, service you're going to get. We also said, say to the providers, you know, have a look at your incident reports, have a look at your own information and data, look at your outcomes. And that might tell you where you need to prioritise the rolling out of this training. Because again, this is about improving outcomes and improving experiences. So look at your own information and act upon it. The training, of course, covers CQC Registered Services. And as I said, you know, we have had good engagement with dentistry. We've done some sessions for dentistry and primary care networks, etc. But that's, we recognise we have a little bit of a way to go on some of those areas, especially some of them smaller employers, and we need to work out the best way to support them in rollout. In terms of students and trainees, we want to make sure that really they're engaged, and we've been thinking again about this, and the conclusion we kind of came to, and we tested this out with some medical schools and some universities, and it felt like the best suggestion we could give to systems and regions was to get students and trainees to do Tier 1 before their first placement. That felt like a good thing to do. It would give students and trainees just more kind of more information, more support, so that they could better support people with learning disabilities and autistic people in their placement, you know, in their first placement. They're clearly going to need to do Tier 2. So if that can be worked out, that's fine. But, you know, as a minimum, we're suggesting Tier 1. Now, we do know that in some of the systems we're already having those conversations, and good conversations, and regions and others. So again, we've left that to locally determine, because that's where the placements are, that's where the relationships are, but that's the advice that we've given. So how many people have we actually trained? Well, since November 2022 and the e-learning was launched, over 1.5 million people have actually completed the e-learning. I don't think any of us thought we would be talking about those sort of numbers. I mean, that's extraordinary, certainly in my experience of something that's launched. So, and the feedback is overwhelmingly positive. It's really amazing to get that feedback. Even from kind of clinicians who've been around for sort of 30, 40 years have contacted us to say, do you know what, I didn't think I could learn anything. I didn't think you'd be able to show me anything, but actually, I can see that, and I've been a bit humbled by this process and by this training. So that's really good. And we're not saying everything's perfect, but, you know, that's really important that, you know, we've got people giving us that feedback. In terms of the part 2, we've got 700 trainers, well, over 700 trainers now trained to deliver the part 2. That might not seem a lot when we've got, you know, just in health alone, 1.5 million people actually to train up. But actually, you know, that's not bad for 6 months, okay? And that number is growing all the time. And there are some regions and systems that are cracking on with Tier 1 and Tier 2 face-to-face, and other systems and regions are learning from them. You know, some have found it easier than others. It's about developing those communities of practice and supporting each other, okay, to get this right. So that's really, really important. We also know that, and we've got about 4 million people who've actually started the training, the e-learning training. And we've kind of thought, gosh, I mean, that's far more than in health and social care, where it was about 3 million. But we know that we've got interest from other kind of sectors, fire, police, justice, you know, education, other countries. So we know that other people are accessing the e-learning part of the training and then asking us about what's the model, how could it work? And obviously it's different for different countries, certainly, and different sectors. But it's really, you know, exciting to think that this is a movement we're creating. And then in terms of the NHS, we've got a lot of support from the systems, from chief execs. Go onto our website, have a look at the champion videos, have a look at social media. You know, we've had some great support, not least Amanda Pritchard, chief exec of NHS England, and the board. They have actually completed Oliver's training, and they did tier 1 of Oliver's training face to face. They actually did that bit face to face, which was great. And Amanda's got a champion video for us. So huge amount of support from the board in NHS England, which is just great. So I'm mindful of time, but in terms of benefits, so let's just remind ourselves of benefits of doing Oliver's training. Oliver's training has set the standards and requirements in the Oliver McGowan Code of Practice, okay, which was required by the Act. So therefore, if you do Oliver's training, you are guaranteed to meet the requirements of the code and therefore the Act. The model is a standardised package of training delivered in a standardised way. So that makes sure that everybody gets the same high quality training and learning outcomes. Employers can have confidence that Oliver's training is recognised by national bodies, advising on standards in the sector, as well as being the government's preferred recommended training, Department of Health and Social Care. And when we say government, it has had cross-party support. Okay, so this has had support from everybody in Parliament. So, which is, you know, again, pretty amazing, and that's just due to Paula, who will be speaking later. Oliver's training has been truly co-developed, and it is co-delivered with autistic trainers and trainers with a learning disability, and that is a requirement of the code, and they must be paid for their time creating you know, much needed employment opportunities. The training is the only training with the permission to use Paula telling Oliver's story, which is part of the registered trademark. So if you see anything else and it's got the logo on and it's not Oliver's training, it's not Oliver's training, okay? And in fact, you need to tell us, because we will then deal with that. The training will become part of the staff passport, because clearly if you've done Oliver's training and you change employers, everybody knows it's a good quality training and it meets the requirements. So that will be a benefit and reduce costs in the long run. It sits alongside all the other ambitions that are really important in terms of Oliver's training. So NHS England and the government have got a lot of ambition to improve outcomes for people with learning disabilities and autism. And this is kind of like one of the foundations of kind of proving that to people, if you like. So it is sitting there. It is an ambition of everybody, and it is an ambition in the long-term workforce plan as well. So please do visit our website. You'll find all the information that I've shared with you. You can contact your ICBs and regions for more local information, because they will have that rather than us, about what's happening in your areas. So really a bit of a whistle-stop tour through. I hope I've managed to kind of give you enough of an update of where we are. And I'm going to say thank you, and I'm going to now introduce our next speakers. I'm delighted that Zohal and Emma, who will introduce themselves, I'm sure, from the Department of Health and Social Care, have joined us. They have worked amazingly, this team, on supporting the development of the Code of Practice, and they're going to give us an update on, I think, all things Department of Health. So over to you.
Thank you, Philippa. Good morning, everyone. I'm Emma, and I work alongside Zohal in the Learning Disability, Health Inequalities team at the Department of Health and Social Care. It's great to have so many people on the call today. So next slide, please. Thank you. So as you'll all know, from July 2022, the Health and Care Act requires providers registered with CQC to ensure their staff receive training on learning disability and autism appropriate to their role. We will publish a code of practice to guide providers on how to meet this new requirement. The code sets out 4 standards, making clear that training must be covering a minimum curriculum of capabilities, relevant to staff and put into practice, co-produced and co-delivered with people with a learning disability and autistic people, and based on evidence and checked to ensure it is of good quality. It's the employer's responsibility to identify suitable training packages for their staff that meets the standards set out in the code. Annex A of the code sets out illustrative examples to help employers understand which tier of capabilities their staff may need. And to support employers to assess the training needs of staff, information on relevant training frameworks is set out in Annex B of the code. Next slide, please. So we ran a public consultation on the draft code, which closed in October 2023. We received a total of 461 responses to the consultation. 375 of these were to the non-easy read consultation and 86 were to the easy read consultation. Thank you to everyone that gave their views. We heard from a range of respondents, including organisations and people with both professional and lived experience. And we plan to publish a government response to the consultation, which will summarise the responses received. So in general, responses across all groups were supportive of the code's purpose and found it clear. Agreement rates across all consultation questions were over 50%. In particular, there was some positive feedback on the co-production and co-delivery of the training with people with a learning disability and autistic people, and recognition that this positively differentiates Oliver's training from other training packages. Other common areas of feedback included asks for further clarification on the appropriate level of training for staff, such as more examples linked to specific roles or services. Support for trainers with lived experience, such as provision of wellbeing support and information on finances. And expectations on repeating training, such as greater clarity on whether the training content would be kept up to date. The government's response to the consultation will outline the feedback in further detail and set out where and how we have sought to address this. We intend to make clarifications in the code, including the examples in Annex A, to address key questions people asked. And where questions raised relate to Oliver's training specifically, we will also be adding some further information to NHS England's existing frequently asked questions webpage. So what are the next steps? Well, we are currently finalising the code before it is laid in Parliament, and it will be publicly accessible from this point. There are a number of processes that need to be completed before we can lay the code in Parliament, and this includes standard sign-off processes across government, which are currently underway. And we're doing all we can to ensure the code is published as soon as possible. We're also finalising an easy read version of the code and of the consultation response, and these will be published alongside the non-easy read versions. Now I'll hand over to Zohal.
Thank you, Emma, and morning, everyone. I will talk a little bit now about how we're supporting the social care sector to take up Oliver's training. If we can move to the next slide, please. Thank you. So our ambition is that we want to ensure that training is seen as an essential part of learning and development at every stage of a person's career in social care. The legal requirement will, of course, support this, but we also want to make sure that it is a part of core learning offers for staff in the adult social care sector. As the Minister described in her video earlier, this has been reflected in the new care workforce pathway, as well as the care certificate. So the first phase of the care workforce pathway was published in January of this year, and the pathway includes an awareness of learning disability and autism under all the role categories described, and a specific recommendation that staff complete Oliver's training. This emphasises the importance of all staff doing Oliver's training and having the right knowledge and skills to provide safe and appropriate care for people with a learning disability and autistic people. Likewise, learning outcomes for the new Level 2 Adult Social Care Certificate will include an awareness of learning disability and autism. Also, the certificate aims to bring together the key skills expected of adult social care staff and to support their development and progression. So with the new additions, it means that all staff who take up the certificate and work for registered providers will have completed training that meets the standards in the Code of Practice, either before or alongside completing the qualification. Next slide, please. Thank you. As well as this, we are commissioning a supplier to set up and maintain a list of endorsed training providers who deliver Oliver's training to the adult social care sector. We recently concluded a procurement exercise for this to find the right supplier to deliver this service, and plan to confirm the successful organisation in April 2024. We are hoping that this service will help to support further training uptake within the adult social care sector, to address concerns about variation in the quality of training provided, and to address concerns about variation in the cost of training being offered by ensuring that a maximum training cost is not exceeded. These are specifically some concerns that we've been hearing from adult social care employers. The organisation delivering this service will work alongside NHS England and ourselves and the accreditation body when that is confirmed, to ensure that all these processes are joined up and aligned. It's also expected that they will, of course, be working with people in the social care sector itself to help shape the endorsement process and make sure that it's right. Whilst these are some ways that we hope to support the adult social care sector at the moment, we are continuing to explore other ways that we can increase training access and uptake further. This includes ways to build further trainer capacity and to embed the training in other plans for adult social care workforce reform. Sorry, next slide. Thanks. Lastly, we wanted to end by talking about plans for the evaluation of Oliver's training. So through the National Institute for Health and Care Research, or NIHR, we are commissioning a long-term evaluation of the Oliver McGowan Mandatory Training. The evaluation will be a really important source of learning and evidence for us all, and it will have two elements. The first element is a process evaluation, which will help us to understand how the training is being delivered in practice and whether this delivery meets the standards set out in the Code of Practice. The second element is an impact evaluation, which will help us understand what effect the training is having on the health and well-being of people with a learning disability, autistic people, and their families and carers. It will also give us insight into the experiences of trainers and the effect that it is having on the skills and knowledge of staff. The evaluation is a long-term piece of work, and a final report is expected to be published in 2027, with interim findings expected as the work progresses. We expect to notify the successful partner who will be doing the evaluation in May 2024, and once this is confirmed, we will share this information wider. Further detail on what the evaluation is planning to include and the timescales for both the decision-making process and the evaluation itself can be found on the website, which is linked on the slides here. Thank you.
Thank you. We're both of you. That was really, really helpful. And as you said, we're really proud of the work we've done to date. So what we're going to do now is we're really proud, as we've said, I think I said a number of times and others have, about the co-production of the programme. We've learned a lot through Oliver's training and are constantly improving how we work with colleagues with lived experience. And we are again delighted to be able to hear from some of our colleagues who've been on this journey with us. So now I'm delighted that we'll be hearing from Hazel Griffith, who's been on this journey for a long time with us as well, and then some of our approved trainers. So Hazel, over to you. Thank you.
My name is Hazel Griffith, and I'm an autistic expert with lived experience, retired emergency nurse, campaigner and carer. I have been involved in Oliver's training from the very beginning, and I'm so thrilled to know staff working in health and care across England will be able to access this powerful and essential training. Oliver's training gives staff the knowledge and skills to support people with a learning disability and autistic people, and to bring about culture change. I personally think if we keep doing the same things, we will get the same outcomes. Oliver's training gives us the opportunity to get it right for people with a learning disability and autistic people. People with lived experience have been at the centre of Oliver's training from the very beginning. The training is about hearing our voices and our experiences. And one of the important benefits of Oliver's training is it creates real paid job opportunities for autistic people and people with lived experience. Many of our approved trainers are in their first ever paid role. I was speaking with a co-trainer the other day who was able to buy their first car. Their job has given them independence and is changing their life. I'm thrilled to introduce just a few of our approved trainers who are rolling out Oliver's training. Our wonderful approved trainers really are the heartbeat of Oliver's training. They're bringing it to life and empower and inspire our health and social care workforce to make a difference.
Hello, I'm Olivia. I am expert by experience, and what I loved about the training is I enjoyed doing the webinars and doing the face-to-face, and I like to help other people with learning disabilities. So this team has been absolutely excellent. So thank you so much for adding me in. Thank you.
My name is Hayden. I'm an expert by experience, and what I've really liked about doing the Oliver McGowan project is learning about what people are going to take away from the training, and it's all been positive and good feedback.
What does it mean to you to have done the webinar training to be able to deliver that to other people?
It makes me feel really important, and that I can help other people as well as help myself if that happens, and I can help other people that's doing the same training as me.
I feel it's feeling like I'm making a change in for the better. The change in the healthcare services for the better for people with learning disabilities and autism.
What does it mean to you to have done the Tier 2 training?
It makes me feel very proud of myself that I've achieved something that I didn't think I'd ever achieve in my life. Because I feel like, because I've got disability, I feel like I feel like that I can't achieve as much as most people. I feel like that sometimes that I feel like I don't know what in myself, I feel like I'm a failure at times. Because of my disability, I feel like that gets in the way of life. But then I've realised now I've done all this, that it actually doesn't.
Everyone with autism is different. Same with learning disabilities, and it allowed me to see myself in a much better light than in the past, and understand who I am.
The Oliver McGowan training will give people a better understanding of people with a learning disability and autistic people, and have a bit more empathy and a bit more patience, and to really stop and think about what that people are saying and what people are doing when it comes to health, so that real changes can happen, because everyone has a right to good health care.
Hi, my name's Taylor. My name's Remy College.
My name is Liam George.
My name is Michelle.
My name is Tyler.
Giving my shared experience, I find, helps to bring the training material to life.
Experience helps to bring a better perspective of how it feels and what you can do to best support her.
You know, the training will help to raise awareness, understanding about some of those changes, some of those reasonable adjustments that will give everyone sort of the chance to access healthcare and to be able to live lives that you know, we would like to.
I think it's important because there are so many myths and misconceptions out there surrounding autism and what it's like to live with a learning disability.
One of the most important things I can tell you is that it is a broad spectrum. Please remember not to judge.
Well, I'm really excited to carry on delivering the training and to be part of many of your kind of learning journeys.
I think it's very important, and I'm very proud to be part of it.
My name is Hazel Griffith.
So thank you to Hazel and all our wonderful approved trainers who put that montage together for us. That was really great to hear their feedback. We know that some people might have joined the call today that actually want to be involved as trainers. So there's some information there. There's a QR code, hopefully better at QR codes than I am, but there's a QR code there, and I think there's information on the website. Contact your local team, as I said earlier, in terms of the regional system. Please do get involved. The only thing I would say is, I mean, carers and family members can also get involved to support people, but the people who deliver the training have to be somebody with lived experience themselves. So that's just the thing to remember. There will be some adverts for jobs going out, but it's a challenge for us to build this up. So please don't kind of worry sometimes if you don't see an advert. There will be things coming, things, you know, will be moving at pace as we move forward. So have a look if you want any information. Hopefully there's stuff on the website, or reach out to your local systems and providers. So what we're going to do now is we're going to have a break.